welcome back to my YouTube channel. It's your girl Anita, A to the N to the I to the T to the A. You know what I'm saying? So, your girl is back with another banger, just as promised. So, if you're a returning subscriber, thank you so much. Thank you for coming back to support this channel. I really do appreciate all the love and the support. And if it's your first time here, welcome, welcome, welcome. Where have you been? So please do not forget to like, comment, ask questions. I do well to answer every questions on the comment section. Let me know what videos you would love to see. Subscribe and do not forget to hit that notification bell so you get notified every time your girl drops a banger. Because trust me, you do not want to miss out. So without further much ado, let's get right to the topic for today. So today we're looking at tips on answering nursing interview questions. So now you are done, you've passed the NCLEX RN and you need to get a job. Either the NCLEX RN or these tips are going to work for any nursing interview questions you get asked. So as long as it's related to nursing. So congratulations on passing your NCLEX RN. So now you need to get a job so you can live the American dream. So yeah, so let's look at some questions. I'm thinking of making this a like series so I don't get to put too much into one video so I don't bore you. So probably make it a 3-part or 4-part series. Just end it with some questions you need to ask the interviewer at the end of the interview. The first part should just be about the questions, the mostly asked questions or the likely questions you get asked during your nursing job interviews. So today we're looking at 3 questions. The first question is going to be, tell me about yourself. And believe me when I say this is going to be like the first question you get asked during your nursing interview. You need to know how to get it right because mostly people do not get it right because they do not know how to answer it. So today you get to know how to answer it so you get it right every time you ask this question. So the second one we're looking at today is, tell me about your strengths. Then the third one would be, tell me about a time you had to handle a difficult patient. So stay with me, do not go anywhere so I can give you the tips that helped me pass all my nursing interviews. After passing the NCLEX RN, I did interviews in 4 different facilities and I got all 4 of them. So I'm going to give you the tips that helped me in acing all these interviews. So let's get right into it. Before we go into the questions, before we go into our first question for today, we have to familiarize ourselves with some important tips. So first has to be about your dressing. Dress the part. Whether I need to wear a suit or whatever I need to do, just look good, look neat and presentable, professional. Either you're going to be in the interview face to face or you're going to be in front of a camera. If it's going to be virtual, just look the part. Secondly, is the time. Arrive on time. Be at the interview, either virtual or face to face. Be there 10 to 15 minutes early. You should be the one waiting for them, not them waiting for you. So please be punctual because they need to know that when you get this job, you'll be punctual for work. So thirdly is going to be, speak fluently, articulate your words properly. Just make sure the interviewer understands everything you will be saying. And lastly, on my list is going to be bold. Do not act scared or anxious because what exactly are you scared for? Speak boldly, look into the camera or look at their faces or the face of the person you'll be talking to. Look at the person's face without being scared. Look into the camera without acting scared because they need to know that in the hospital or during emergency situations, you won't start getting scared. You would face the challenge. You look at the challenge in the face and you deal with it. So please, these are some important tips you need to look at. I had a friend tell me she had to even put on glasses for the interview. So whatever you need to do to just look professional, hey, just do you, but just make sure you do it well.
So in this tell me about yourself question, you want to tell your interviewer a good professional work story. Your story should be clear, it should be concise, it should be engaging, it should be convincing. Just feel good when you talk about these things. So your interviewer can in turn feel good when you say all these things. So tell them about your work experiences, the job titles you've held, or the current job title you hold in, those responsibilities you've had to carry out while holding those job titles. Let them know how those responsibilities, those skills, those professional attributes have been effective in delivering patient care, improving patient recovery rates. Talk about how you've been able to collaborate with other healthcare teams to improve, patient outcome. Talk about the responsibilities you've had, probably how, for example, if you've had to volunteer to train the new nurses or the nursing students, probably a case study about patient recovery rate. Just shine, talk about the achievements. Let your interviewer know that you are aware of those responsibilities that are best suited for this role you are applying for. Just tell them about those skills and those attributes that set you aside, because hey, there are a lot of people that are actually applying for these job titles. So shine and tell them a lot about your professional experience. Tell them about how those skills and attributes set you aside and how they will actually help in delivering effective care to your patients, knowing that patient care is the goal. So when you're talking about skills, you want to talk about basic skills like patient care, patient education, emergency care, medication administration. And if you're going from some particular roles, probably as an emergency nurse, you want to let them know you're aware about the emergency care response, the emergency drugs, about prioritizing patient care as per charge, prioritizing patient care in terms of urgency and importance. If you go as an ICU nurse, knowledge about your ventilator settings, let them know you are aware of that, and also emergency response, how to take care of patients, airway, breathing, circulation. If you're going as a med-surg nurse, you want to let them know that you are aware about your pre and post surgical patient nursing interventions, how to actually improve patients' pain outcome, take care of patients' pain, probably with pharmacological method and non-pharmacological method. Just shine in this question. Let them know about your skills and your attributes. You can also talk about your strengths in this question, but you're not going to talk about them as strengths. You won't go in depth. Probably just talk about how you're compassionate, a team player, how your organizational skills, how you pay attention to details. Just let them know about all this, because they need to know what is the need for them, like why do they need to employ you. So this story has to be convincing. They need to know why they need to employ you. They need to know about all this good stuff you possess. They need to be convinced that okay, yeah, this person is actually well suited for this job. So you could also try and research about the facility's mission and values. So you talk about how those skills, how your skills and your attributes actually align with their mission and values. How whenever you are, taking care of patients, how you always have to put in mind their values and mission, how you be able to actually make sure you propagate that during your patient care delivery. So you also want to end with why they need to hire you. Talk about those skills, those attributes, how those skills and those attributes would actually be beneficial to that facility. So just make sure you kill it in this question, because this actually sets the pace for the other questions. So we're talking a lot about this tell me about yourself question. So let's look at an example of how you can articulate all this, bring it together, and answer this question accurately. So the second question on our list is tell me about your strengths. So this is a behavioral question. Answering behavioral questions like this, I would advise you to use the STAR method, because this will help you in articulating your response. So you deliver every time you're asked this type of question. The STAR method is S stands for situation, T stands for task, A stands for action, and R stands for result. So this will work every time, because I use this every time and it worked for me, because you actually want to make sure you sound like a pro, make sure you're well organized when answering your questions, because this would actually help. So I would advise you to actually pick about 3 strengths you will talk about every time you ask this type of questions. So for today, we're talking about 3 particular strengths. One would be communication skills, two would be about teamwork, being a team player, the third one would be about organizational skills. So let's get right into them. So talking about communication skills, I'll say before you answer this question, it's very important to try to acknowledge it. If that makes sense, you could be like, I understand how important it is as a nurse to possess communication skills, as I'll need to advocate for my patients, need to communicate with other members of the healthcare team about patient care so as to improve, patient recovery rates, improve patient care, and deliver effective care to my patients. Let's say, for example, you are applying as a med-surg nurse. You want to talk about how, as a medical surgical nurse, you feel one of the skills you need to possess, the very strong skill you need to possess as a med-surg nurse is communication skills, because you need to communicate to the healthcare provider, other members of the healthcare team about pre and post-surgical patient care, and to ensure continuity of care, to make sure that the best care possible is being delivered to the patient. Just talk about it like that. And I also want to cite an example when you've actually used this strength in delivering effective care to your patients using the STAR method, that's situation, task, action, and results method. So for your organizational skills, you want to acknowledge the question, talk about how it's important as a nurse to possess organizational skills, because to help you in prioritizing patient care, using critical thinking, clinical judgment, prioritizing care in terms of urgency and importance. Talk about how with your organizational skills you're able to actually quickly assess your patients, knowing what needs to be done, assess patients so you can make decisions based on the qualities you possess and your experiences, ensuring patient safety, and also ensuring that the medical needs of the patient are being met. Talk about how with your organizational skills you're able to prioritize care, paying attention to details, looking at situations with a critical eye so you actually do what needs to be done, minimizing any form of errors or mistakes, and also making sure that you are doing this in a timely manner. You give yourself a deadline so you do what needs to be done and move on to the next task, because we are dealing everything in order of priority. So with your organizational skills, talk about how you're able to get this all done and ensuring that effective and efficient care is delivered to your patients, because that's the most important thing. Patient goal, everything should be patient oriented. So you can also give an example using the STAR method, the situation, task, action, and results. So the next skill or the next strength we're talking about is teamwork, being a team player. First of all, acknowledge it. Talk about how you understand it's important as a nurse to possess that skill as a team worker and as a team player. All these skills you're talking about, all the strengths, you are giving examples using the STAR method. Talk about how you understand that collaborating with other members of the healthcare team is very important, collaborating with the HCP, the healthcare provider, collaborating with the occupational therapists, the physical therapists, the respiratory therapists as needed for your patient to ensure continuity of care, to ensure effective care is being delivered to your patients, and to also help to improve patient recovery rates. So the last question we're looking at today is mention a time where you had to handle a difficult patient. So first of all, like I said, acknowledge it. Talk about how you understand that as a nurse you will tend to deal with different people and different people from different backgrounds, and they also have their different personalities. Talk about how some patients might need to vent their frustration, probably as a result of their medical diagnosis or the treatment they are currently undergoing, and how it's important for you as a nurse to be able to understand these things and deal with these situations effectively. Talk about how you need to be empathetic with the patient, you need to be understanding, listen attentively to the patient. You have to open lines of communication, therapeutically communicate with this patient, be professional, maintain professionalism while being empathetic. You might need to set clear boundaries if needed. So also need to cite an example where you had to use this skill in taking care of a patient. Give an example using the STAR method, the situation, task, action, result. So just talk about these things. Talk about how you need to understand this patient, identify the cause of the problem, and make sure that you don't let this patient's frustration get to you. Instead, you actually be professional about it. Make sure at the end of the day is a positive result that you achieve.
Hi everyone, we finally come to the end of this video. Thank you all for staying with me. Thank you for liking, for subscribing and hitting that notification bell as you should. So I hope these tips are useful to you, and do let me know what you think in the comment section. And you could also put in the comment section the questions you like us to go through in the second video. So thank you all so much once again. Till we meet again, I remain your favorite girl, Anita. Bye bye.